Good morning! Very good. One pa. Energetic pa. Okay. Friends, let me start my piece by giving this data so that public may know our workload and our resources. I know kanunay mi nga starring kanunay sa radio, especially our medicines. Siguro they could understand nga ni naabot ni nga situation. Our total number of admissions from July up to September is 3,642 aside from our consultations. And 13% of this comes from outside Iligan, which means that expenses incurred by these patients are shared from our very own resources. Our authorized Department of Health bed capacity is 119 beds, and our daily average census of patients are 127 patients per day. So our occupancy rate from the past 4 months is 107%. So at least you know now the workload and the resources of our hospital. Our top 5 leading cases of admissions are the following. Still, the normal spontaneous vaginal delivery may be, quote-unquote, the rationale of the RH pill. Number 2 is pneumonia. According to the Philippine College of Physicians, pneumonia vaccine is a must for all 60 years old and above, especially those suffering from chronic disease like diabetes. Why? Because their immune system is compromised. So, my dear senior citizens, including me, I think this is really very nice to consider the pneumonia vaccine. We have the pneumonia 23, which is given once every 5 years, and we have the flu vaccine given every year. Number 3 is acute infectious diarrhea. How can we prevent this? Number 1 is proper hand washing. Sa una na, proper hand washing. Pero karon, high-tech na ta. We have now proper hand hygiene because we have the alcohol gel, we have the alcohol. Sa una, wash ng hands. And sa una, we have to drink boiled water at least 20 minutes. Kaya kung less than 20 minutes, some of the common organisms, which is E. coli, galing sa feces, dili mamatay. So, we have to boil our water with at least 20 minutes. And now, available naman atong purified water. So, it is really safe for drinking. And proper food handling. Dili lang ta kay daghan ra ba kay so far sa hospital food ay naasilay ka ng mamaligya o mga pagkaon. You have to consider this because the hepatitis A can be transmitted through these mga pagkaon. And the number 4 is UTI or the urinary tract infection. Prevention is increase fluid intake to 10 to 12 glasses per day. So this is the time siguro we have to bring tubig na sa atong maski sa atong mga office. And proper hygiene, especially for women. You know, ang atong yung practice is we have to wash up, down, not down, up. I think masabtan siguro ko sa mga women. Ha? Okay, and we have to avoid salty foods. And number 5, actually there are 10, pero 5 lang niya siya akong is hypertension, which is the common complication is heart disease. So, how can we prevent this? Now, if we are already hypertensive, please don't forget to take your medicine daily. Dili kay, I'm feeling good, so I will miss the dose today. It's not good because anytime your blood pressure can go up, and that's dangerous. We might have myocardial infarction or MI. Now, observe healthy lifestyle. So we have to move every now and then. Even if we are managers, kanunay lang tang nakalingkod, right? Now, even if we are on the sitting position, we could still exercise our tummy, diba? By having deep breathing, okay? Now, every now and then move because being sedentary is one way of that can develop hypertension. Another is we have to eat fruits and vegetables. It's really very important. Dagan naman kain ng mga vegetable na mga barato ra. Dili necessary ka tong mga broccoli. Diba? Grace, mahilig o broccoli. And then we have to minimize sugary, salty, and fatty foods. Then, don't forget, stop smoking. Minimize, stop smoking. Diba? We have an ordinance already sponsored by the Sangguniang Panglungsod. And then, exercise 30 minutes most of the time in a week. What is most of the time? Ang pasabot ani, we have to exercise 30 minutes 5 times a week. Dili lang buntag. If we are really very busy in the morning, then we can do it in the afternoon or in the evening. And manage our weight. Daghan ko nakita mga city government employees, dagko kaitiyan. Di na maayo. Why? Because that's a signal na pwede tang magka-diabetes in the future. So please, dapat kuno ang lalaki, dapat ang waist is 35. Dapat ang babae 32. Fit pagyapon ko pag abot ng 32. Avoid or minimize stress. I know di nato na ma-avoid being government employees, but ma-minimize nato. Why? Because stress can cause what? Cancer. Very good. We have to wake up. Now, with regards to our dialysis units, the structure is 100% completed. Implemented by the CMO Technical. Thanks to Engineer Terry Bajang. Where are you? Ay, Bajang Herrera di ay. I'm sorry. Loving husband. We are now applying for permit to operate from the Department of Health Manila, together with our renewal of our hospital license to operate. We are also waiting for the 3 nurses who are having their training in Northern Mindanao Training Center, and they will be back by December. Probably, we could operate the dialysis unit early of 2012. In God's grace. And I also hope we can solve our water shortage. But I think even if we have water shortage, we could still manage to operate. Why? In one patient, we only need 1,000 cc or 1,000 ml of water. Fortunately, we have that tank there na more than 5,000 ml ang iyang sulod, and our dialysis clinic will only cater to 3 patients. So kung 3 patients, 3,000 cc or 3,000 ml, na pa may sobrang duha. Di ba? So, murag dili kayo na mo i-consider ang water shortage. So, our Ma'am Christine, if you can share additional, mas okay. Thank you. Now, the updates on KOICA. The Korea International Cooperation Agency, through the effort of Councilor Attorney Yang, has approved 1.2 billion soft program. Dili nato ni bayaran ha, ihatag lang ni sa atoa. And out of the 5 proposals, it's only the GREGORIO T.LLUCH Memorial Hospital nga nakapasar. So a big hand of applause. This is part of the GTLMH expansion and modernization plan in support of the universal health care of the Department of Health. We had opened also last June, our new building, 10-bed capacity for OB PhilHealth Ward building. So naataan na so far. So ang atong mga PhilHealth na OB patients, maka-avail na atong nga room. Medyo gwapo, dili, gwapo. Guapa. And we also have our improvement of our physical status of our hospital. Thank you for the support of the mayor and for lending us Engineer Terry Herrera. Wala na po na sa'yo pa. Engineer, for the implementation. We have the construction of nurse station for OB-GYN. Ingon sila, pinangga daw na akong OB-GYN kay OB-GYN ko. Pero, kani siya, 2 years ago pa nila ako na request. Wa man di follow up. So, karon na siya na-implement. 95% completed and implemented by Decon Construction. And we have also the rehabilitation of our comfort rooms of the different wards in the hospital. 95% completed and implemented by CMO Technical. We have the rehabilitation of our emergency room and administration building. You see, nakapintal na ni, di ba? Gwapa na. That is 85% completed and implemented by CMO Technical. And we have also the rehabilitation of our electrical system. 50% completed and implemented by CMO Technical. Last is the rehabilitation and improvement of our cashier's office, laboratory and radio room, as well as our social worker's office. It's 45% completed and again implemented by CMO Technical. Last, it's nice to know that PhilHealth Circular Number 011-A-2011 for selected PhilHealth medical case rates. Kuan na karon, kingalan ani. Naanay gihatag na amount ang PhilHealth na package na if the patient will be admitted in a government hospital, wala sila'y additional pay because it is now the non-balanced billing policy of PhilHealth. For the medical case, mauna ni siya. We have dengue 1, dengue 2, pneumonia 1, pneumonia 2, essential hypertension, CVE 1, CVE 2, acute gastroenteritis, typhoid fever, and asthma. But if the PhilHealth member is admitted sa private hospital, naagapon siya bayaran na excess. If the patient will be admitted in our hospital, which is a government hospital, paggawa sa pasyente, wala siya bayaran, kundi zero for sponsored PhilHealth. So, it's now time for us, help us to convince your neighbor, your friends, na who has PhilHealth sponsored member na ipa-admit sa amua. Through that, we could augment hospital income through, at least naman, but these PhilHealth patients are also supporting our indigent patients. So, actually, ang among tambal sa mga PhilHealth, wala problema. Ang amo lang tambal ng regular medicine for the kanang indigents, diya may magka-problema. So, with the PhilHealth medicines, this will support the non-indigent PhilHealth patients. So, mauna, I would like to plea na support us, na katong mga patients, sponsored patients na PhilHealth na to be admitted in our hospital. Because we will really try our best na as far as tambal for PhilHealth patients are concerned na amin, especially for patients na paingon sa operating room. I see to it na naana siya. Dito lang may nagka-problema sa among mga indigent patients, which is mauna ang tira sa amo sa radio.